The German health minister has arrived in South Africa ahead of an expected announcement on how to help the country boost its COVID-19 vaccine production. Jens Spahn is holding talks with his South African counterpart, Zweli Mkhize, as infections there have been steadily rising. The trend is especially worrying because less than 2% of the population has so far been inoculated. But the vaccine rollout is making some progress. We sent our reporter to a vaccination center in Durban.
Accompanied by a police escort, a very important delivery. 300 precious COVID-19 vaccine doses. Hundreds of eligible senior citizens over 60 have been waiting at this vaccination centre in Durban since morning to get their inoculations.
I'm not happy at all because most of the people has lost their lives. So that is why we came here, so that we get vaccinated, so that we'll prevent it.
I think we're all very excited about at least getting into line here and getting it over and done with, and then we can get on with our lives again.
Fewer than 2% of South Africans have received a jab so far, less than 1 million people. And new infections are on the rise again, a troubling trend that signals the beginning of a third wave.
Obviously, if numbers go up, we do worry. However, we do have our response plans in place, and we are ready to respond if the numbers actually rise any further than it is right now.
Tighter restrictions could be on the cards. Infection rates have been low over the past 4 months, but more and more people have been ignoring the rules, like compulsory mask wearing. Political mass gatherings have also been taking place. At the vaccination site next to the World Cup Stadium in Durban, the immunisations bring some solace amid the fears of a resurgence.
Is it painful?
Yeah, I'm feeling very relieved. We're just hoping that this pandemic disappears and put us back to track.
Let's go to Johannesburg now, where DW's Adrian Krisch is standing by for us. Hi, Adrian. Put this into context for us. Another infection wave does appear to be hitting South Africa, and the vaccination rate, as we heard, is still very low. So is COVID-19 again becoming a big problem for the country?
Right, since the second wave ended in the end of January, things have been almost back to normal here. Very few restrictions were in place. Now restaurants have been opened. Life is sort of back to normal, but we have seen an increase in cases over the past 2 weeks. Experts here are warning that this is the beginning of a third wave. It is hard to tell if it's going to be worse than the second one, which hit the country quite badly. But most people here expect the government to announce stricter lockdown rules in the next days.
Meanwhile, the German health minister is in South Africa to promote the fight against the virus. What exactly will he be doing there?
So he's currently meeting the South African Minister of Health, and they are mainly talking about how Germany can support local vaccine production. This will be the big topic of the day this afternoon. There's a roundtable planned together with the French president, who is currently in the country as well, and the South African president. It is likely that the big announcement will be made to enhance local vaccine production. We don't know yet what the plan is going to look like, what package they are going to announce. What it is clear, though, is that South Africa has had massive problems in the vaccine rollout simply because they had problems to access enough vaccines. South Africa ordered vaccines for 75% of its population, but only a fraction of that arrived in the country. So at this point, only those above the age of 60 can start to apply to get their vaccine. But about 1% of the population only got it, and even people who have comorbidities and are younger than 60, they're not even sure if they'll be able to get a jab by the end of this year. So this is a massive problem. This is, of course, not fair. Many people here are complaining about that Germany, we're debating about vaccinating children, while people with comorbidities don't see a perspective here. So this is certainly something that will be discussed and hopefully addressed as well.
DW's Adrian Krisch reporting from Johannesburg. Thank you.